All right, so good morning, everyone. We are going to tackle SAS 5 to 6 for our subject TFN. So for this particular subject, for this particular SAS rather, we do have the theory of Myra E. Levine's conservation model. So when you talk about Myra Levine, it's she is actually born way back in 1920. No, she significantly influenced nursing theory and holistic patient care practices, and developed in 1973 the conservation model emphasizes energy conservation for optimizing patient health healing process. At the same time, her model advocates for comprehensive nursing that address patients' physical, emotional, and social being. So, how did this theory being developed? So, we do have theoretical sources, particularly with the general systems theory, that Levine's model draw on general system theory, emphasizing interdependence and dynamic interaction with nursing care environment. So, if you're going to care for your patient, the environment is very important. We also do have the adaptation theories, which is an integration of adaptation theories, underscores the importance of enabling patient to adjust to health challenges effectively. And when we talk about adaptation, as what we have discussed in our previous theories, no, it's more into how your patient able to adapt to its certain environment, to its particular management coming from the hospital setting. Is just say, for example, no, or student nurses on how they adapt into the environment that they are right now in terms of stress, in terms of motivation, and etc. We also have holistic integration, which is inspired by Nightingale. So this incorporates physiology and psychology, thus fostering a comprehensive approach to patient care. So in this model of Levine, it's very important that we have to consider really the environment. Okay. So the uses of the major concept, no? So we do have the conservation of energy, which focuses on optimizing energy balance, which is essential for enabling patients' recovery and maintaining overall health. When we talk about conservation of energy, patient needs to conserve certain energy in order for them to attain homeostasis. And at the same time, the conservation of structural integrity has its preservation of the physical body structure, which enhances resilience, promoting healing, and fostering patient autonomy and care. So very important that we also have to consider as well the physical health of our patient, in which the energy plays a vital role in terms of preserving certain ways that your patient can somehow promote healing and even recover from certain diseases. And with conservation of personal integrity, it has something to do with respecting patients' identity, which identifies as crucial for tailored interventions enhancing trust and therapeutic relationship. So as nurses, it's very important that we have to establish rapport and also trust to our patient. It's very important that these therapeutic relationships that we are doing can somehow bridge towards how we provide care to our patients. So we have major assumptions for nursing, person, health, and environment. So with adaptation through conservation, nursing facilitates adaptation by promoting the conservation of resources essential for patient health and healing. Very important that aside from patient conserves its energy, we also have to consider resources that are physically present that we can provide to our patient. Very important that um, we can facilitate adaptation to our patient during the times of recovery, because it's one way that it's easier for them and it's faster for them to recover certain illnesses. No? We also have the holistic perspective, considering patient as holistic being, emphasizes their interaction with environment, fostering comprehensive nursing assessments. And a dynamic health pattern, which is conceived as unique adaptive pattern, reflecting individuals' responses to internal and external factors. So what do you mean by internal and external factors? These are factors that can somehow influence the different patterns of our patient in their everyday living. No? So say, for example, the type of weather that we do have that can somehow influence as to how your patient will somehow adapt to its health recovery. A very good important, another good example are the resources that are present in the hospital. When we talk about the hospital setting, say for example, the equipments, the facilities are very important in which our patient can somehow attain health, no, or recover with certain illness and diseases. And talking about empirical evidences, we do have empirical evidences which includes demonstrating effective energy conservation role in managing chronic illness effectively. We also have to consider linkages in research, which we correlate conservation principles to improve patient outcome, highlighting their significance in healthcare practice, and of course, validating such studies, which its application and validation on Levine's model confirms its efficacy in diverse healthcare setting and practices. So when you talk about empirical evidences, these are observations, experiences, no, that this particular theory is being adopted. So we have theoretical assertions that nursing interventions, necessary nursing interventions, no, facilitates conservation, ensuring patients receive optimal support during their health healing process. It's very important when we provide intervention to our patient, we also have to consider assessing the optimal wellness of our patient. With the support that we are giving to our patient through these nursing interventions, what are examples of nursing interventions? When you give medications, when you do suctioning, when you do certain procedures, as a very good example, no, suctioning, feeding, tracheostomy. We also have providing critical assistive interventions such as doing CPR or cardiopulmonary resuscitation. That those are certain interventions which we provide support during the healing process of our patient. No, that's what is being indicated in her theory. And when we talk about self-care roles, it has something to do with bolsters patient empowerment, showcasing the importance of active participation in health management. As nursing students, it's very important that we have to educate, do health education to your patient at all times. This is one way for us to make sure that our patients are able to understand the importance of self-care, because when they will be discharged at the hospital, it's up to them as to how they'll be able to manage their health properly. But if they are still confined or still admitted in the hospital, one of the basic role of the student nurse that you can do is really to provide health education to them. Very important as well that we have to consider the predictable outcomes of the theoretical assertion, which is systematic strategies for conservation lead to predictable outcomes, enhancing reliability and consistency in patient care. For logical form, we do have some structured approach that the model offers a systematic framework guiding nurses in enhancing patient care through clear methodologies. So what we are doing to our patient has a structured approach. It's very important, no, that according to her model, this particular framework has a certain procedure that we have to do in sequence in order for us to provide it in a logical way. With a systematic assessment, this would somehow emphasize your evaluation of your patient's need, ensuring targeted and relevant nursing interventions are being applied. And at the same time, when we try to measure these outcomes, we have to focus on establishing defined goals, which aids in evaluating the effectiveness of nursing strategies and intervention plans. So how it is being accepted in the nursing community in terms of education and research, it's actually a widespread adoption in education because the model integrates into the nursing curriculum that what we are doing right now, which is a very good example of which is your return demonstration. We also have to consider as well that it emphasizes patient-centered care to our students, that it is being utilized certain techniques for future practitioners or for future nurses. No? Another thing is the foundation for research, which serves as a basis for diverse studies promoting exploration of energy conservation and its implication in healthcare. A very good example, as we know, in terms of its acceptance to research, is that we use the model or the theory of Levine um, in terms of the theoretical framework. No, it's also very important that we have to consider that the theoretical framework would somehow serve as a backbone with the theory, with the research. No? Another thing is the advancement of nursing knowledge, which we recognize for significantly improving care delivery, fostering an evidence-based approach that enhances patient outcome. We always have to consider that what we're doing for our patient would really benefit for our patient. So for further development, we have geriatric expansion. No? The model has its principles that are being adapted, specifically targeting the geriatric population to enhance care quality. Why? Because these patients, no, in the geriatric population, they're more vulnerable. When you reach the age of 60s, perhaps, or probably 55 and above, tendency is you might be able to have certain diseases, develop certain diseases. And with these specific interventions, procedures, techniques, internal and external factors, no, that you apply to your patient can somehow alleviate what the patient is feeling in terms of the disease and at the same time improve or even recover. In terms of integration with theories, we are combining Levine's model with existing nursing theory, which promotes holistic, multidimensional patient care strategies. As mentioned earlier, we are also considering the environmental theory of Nightingale as what we're trying to integrate with the theory of Levine. However, Levine's theory has something to do with its promotion because of its holistic approach to the patient. So it can really be combined with other theories. No, it's somehow versatile. With future research direction, we have an ongoing research aims to customize the model for various healthcare systems and culturally diverse population. So for the critic, we do have limitations in acute settings. The model conservation emphasis may restrict its effective application with a fast-paced acute healthcare environment. That is correct, no? Because in the hospital, say for example, our pacing should be quick, no? You don't need to. You should make sure that you have to manage your time, and somehow, in terms of time management, there come a time that some of the procedures are not anymore in sequence or not anymore applied properly. No, we also have cultural context adaptation, which is the challenges arise when adapting the conservation model across diverse cultural settings, complicating its universal applicability. And implementation guideline needs, which needs to have a clear framework for implementation of Levine's principle, which is essential for practical nursing integration and effectiveness. And to summarize, we have energy conservation of its model, prioritizing conserving energy, essential for enhancing patient healing and overall health outcomes. And it's being influenced by Nightingale because the model supports a holistic approach to patient care and nursing ethics. And of course, its critique responses, despite no, the conservation model of Levine, it still remains, it's adaptable, it's evolving within contemporary nursing practice. Considering as well, note today that the specific response of this model has something to do already with the integration of technology. And I believe that if there would be an integration of technology, it would be easier and effective, efficient for our nurses to provide, no, or to apply the conservation model of Levine. So to conclude, Levine's model cultivates critical thinking in nursing education, preparing practitioners for holistic patient interaction. The conservation model principles remain applicable, guiding modern nurses in terms of complex healthcare environment effectively and encouraging further research and innovation integrates the model into evolving practice for enhanced patient care. Now we will proceed with exploring Martha Rogers' nursing theory, which is the science of unitary human. So just a quick credential and background of Martha Rogers. No, it's more into the revolutionizing nursing, which emphasizes patient holistic health and integrating environmental factors in care. We do have key elements which include human being, the environment, health, and nursing promoting unified practice approach. And at the same time, Rogers' framework foster critical thinking, encouraging nurses to adapt practices, emphasizing patient-centered care. So, with its sources for its development, Rogers' theory intricately integrates with the interdisciplinary influences, particularly with system theory and quantum physics, enriching nursing's conceptual framework. We also have the energy field concept, which her theory is grounded in Einstein's relativity, emphasizing the significance of energy field in nursing. And at the same time, its holistic integration of the wholeness and pattern promotes a comprehensive perspective of patient health management in nursing. It's very important that there should be unity in terms of providing care to our patient. We have to consider the certain policies and procedures that are being implemented in the hospital, the medical management of the doctors, no, that we provide to our patient, and of course the holistic care that we provide to our patient. So with this kind of unity that the patient is getting in terms of recovery, it's very important that we nurses should balance, we should strike a balance to it. It's very important that we have to make sure that these procedures, these policies, and even our nursing care to our patient are well united so that patient won't get confused. Patient will be able to adapt to whatever is being implemented to him or her based on the practices of the hospital. So the major concepts of the theory has interconnectedness of its energy field, that the concept posits that every individual exists with a mutual energy field with their environment. Humans engage in constant energy interaction with surroundings, impacting health and well-being significantly. And with its dynamic pattern, it's really unique in terms of energy pattern because it reflects personal experiences vital for understanding individual patient care need. It's important as well to consider that your patient in its activities of daily living should have certain energy that they can acquire at the beginning of the day, because it's one way for them to recover. So with us nurses, we have to consider the safety of our patient that they're trying to consider in terms of interconnectedness of energy. Very important that we also have to make sure that when patient tries to stop with activities of daily living, we also have to consider the balancing of management, no nursing management. How do we do this? Proper nutrition, proper medical management, no health education, perhaps is also a good way that we can consider. And at the same time, it's collaborative and communicative process with the other healthcare practitioners. Very important that we have to coordinate with the doctors, with the medtechs, with the PT rehab, the dietitian, and whoever who would like to manage with the patient. So major assumptions in nursing, person health, and environment. Her framework positions nursing at the interaction of scientific rigor and compassionate patient care. And when we talk about holistic person view, it defines the person as integrated entity and transcends mere biological components within environmental context. And we also have the health as energy balance, which conceptualizes health as a subjective state reliant on the equilibrium among personal energy field and interaction. So in terms of empirical evidences, therapeutic touch has a significant role. Research highlights that positive influence of therapeutic touch on energy field and patient healing outcomes. When you say therapeutic touch, you touch the patient in a way that you somehow feel what the patient feels or trying to communicate your patient in a nonverbal cue. Okay? And we have to be very careful in terms of therapeutic touch because there are some cultures who doesn't really wanted us to have that kind of intervention. No? Say for example, the Muslim community that we have to consider what particular sex of the female, I mean sex of the nurses who will be catering to those with the female sexes. No, we also have environmental factor research. Investigations reveal how environmental influence dynamically interact with human energy field, affecting well-being significantly. And we talk about holistic case studies, which demonstrates efficacy of holistic nursing intervention aligned with Rogers' theory in various patient scenarios. In terms of assertion, we have harmonizing energy fields. So nursing interventions focus on restoring harmony and balance in patients' energy field for optimal health. And also The theory encourages a comprehensive approach to view individual with their unique environmental context successfully, and at the same time, its outcomes of nursing care are assessed based on observed changes in energy flow and patient pattern. So there might be a question that would somehow arise, sir, what if our patient doesn't have enough energy to do the activities of daily living or to start their day? So we nurses would somehow find some alternatives, no, as to how we can provide proper exercise, no, proper nutrition to our patient, and at the same time, achieving health or recover or even improve from time to time, no, or in a daily basis. So say, for example, if your patient is bedridden, a bedridden patient couldn't do his or her activities of daily living. So we have to consider passive range of motion or exercises. No, we also have to consider, no, if considering the hygiene of the patient. No, instead of patient going to the bathroom, we do need to make sure that our patient is well bathed through bed bath. We can even shampoo the patient. No? That's one way for us to make sure that our patient can somehow gain positive energy levels. Okay? If your patient has an NG tube and couldn't somehow eat through mouth or per Orem, then it's very important for us to provide proper nutrition through NG feeding or nasogastric feeding. Okay? The feeding would somehow pass through with a nasogastric tube. No, if you can picture out, no, a nasogastric tube is being placed into the nose of the patient or to the nostrils of the patient, going towards the stomach. No? So that's how you try to picture out a nasogastric tube, and a blenderized feeding is given. Okay. In terms of giving medication, if the patient couldn't take medications, then we can somehow administer it through NG feeding. We just have to pulverize the tablets and make sure that it is mixed with certain amount of water and then feed it to the nasogastric tube. Okay. And that's one way for us to make sure that our patient has better care outcomes. Okay. Logical form, we do have the nonlinear complexity that the theory embraces life's nonlinear nature, emphasizing the intricacies and interconnectedness with human experiences. We also have holistic patient care framework, which provides a structured approach for understanding patient care integrated with mind, body, and environmental interaction, and encourages no adaptive and personalized intervention tailored to individual patient needs, enhancing overall care efficacy. So, in the acceptance of nursing community in terms of education and research, Rogers' theory serves as a cornerstone for imparting holistic principles in nursing curricula effectively. And it is a catalyst because it establishes the foundation for studies investigating energy-based therapies and alternative nursing approaches extensively. And it also influenced on nursing models, which inspires subsequent holistic models integrating diverse practices into contemporary nursing education and professional pathway. So with this type of model, no, it is being used in research. Of course, no, if you're going to anchor the study of the theory of Roger, no, and at the same time, if we are also considering in education with student nurses, these student nurses are being trained to be part of the care management for our patient. If the patient couldn't somehow perform certain tasks, no, with the help of the student nurses, patient will be able to achieve, no, certain interventions dependently to the student nurse or to the nurse. Its application to hospital and school setting, it has something to do with the implementation of therapeutic touch, which enhances healing by promoting energy flow and patient relaxation during recovery. We do have holistic education. Integrating mindfulness practices ensures future nurses are well equipped to provide comprehensive, patient centered holistic care. And at the same time, nurses' healing role, fostering awareness of energy field, allowing nurses to create supportive environment conducive to patient healing. So for further development, we do have modern integrative health practices that Rogers theory informs integrative health approaches, underscoring energy dynamics in enhancing patient care paradigm. We also have development of interventions leverages energy field understanding to design innovative therapeutic practices for patient, which is very important. Note today that in the technology has something to do with the development of intervention. Say, for example, no, with the use of an infusion pump, it's already easy for us to titrate the drops per minute or the flow rate of our IV to our patient, which is one click, no, with a start and stop buttons, no, and even incrementing and decrementing the amount to be delivered to our patient, no, it's just easy for our patient to get the the intended fluid, no, on that particular day. Another thing is the cultural context research, which is an ongoing investigation aims to validate the theory relevance across diverse cultural framework in nursing practice. So from the critique, it has something to do with the abstract nature of the theory, which critics argue that Rogers' theory lacks practical applicability due to its highly abstract and conceptual framework. We also have energy field measurement challenge, which is a scientific validity faces scrutiny as quantifying and measuring energy field remains empirical, complex, and conscientious. We also have need to concrete guidelines, which critics emphasize the necessity for well-defined operational guidelines to facilitate nursing practice application effectively. And to summarize Roger, theory, we underscore the significance of bidirectional relationship between individual and their surrounding environment. We also have the model introduce a transformative approach advocating for individualized care rooted in patients' broader context. And despite some critics, Rogers theory still continued to influence holistic practices significantly across various nursing disciplines. Now we'll proceed to Orem. Okay, so this is the self-care deficit model. Orem's, just to give a credential and background of Dorothea Orem, Orem's theoretical framework transformed nursing practice by emphasizing patient empowerment and responsibility for self-care. It's very important that we have to consider its influence to the education, the field of education. The her model advocates for educational initiative that enhances self-management skills among nursing students and patients, and the legacy and impact which ARMS works to continue to inspire contemporary nursing practice in which emphasizing autonomy and individualized patient care strategy. So what is the how the theory being developed? No, it's more into the philosophical foundation that RM's theory builds on the philosophy of self-reliance, emphasizing individuals' autonomy and accountability, meaning to say that your patient are being trained to become accountable for themselves and being autonomous. No, because not all the time that nurses, doctors, health allied practitioners would be on their side every time that when they go home or when they being discharged in the hospital, these patients have to work on their own. They have to recover on their own. That is why we have to make sure that we build autonomy to our patient through health education, through knowledge transfer, through return demonstrations for the significant others if the patient is bedridden when they go home. We also have the integration of systems theory that the framework synthesizes systems theory concept to enhance understanding of patient behavior and self-care, and the human development insights, which incorporates human development principle, ensuring that self-care practices are age appropriate and contextually relevant. Okay, so we have to consider as well if your patient is pediatric. So if your patient is below 18 years old, so 17 equal to or less than 17 years old, then the significant other or the primary next of kin will be the one to take good care of the patient. We also have the use of major concept, which is defined as purposeful activities which individuals execute to uphold their health and well-being effectively. We also have identifying moments when individuals lack capability or resources for effective self-care, impacting their health outcomes, and nurses employ compensatory or educative process to support patient in overcoming identified self-care deficit. So it's very important that we student, that you student nurses would somehow provide proper education to your patient. We really have to go back with health education because that is your primary role in the healthcare, And considering that your patient has self-care deficit, then you must be able to identify that at the time of your assessment, no? If you see that your patient cannot do her activities of daily living alone, then we have to make sure that we apply what Orem is trying to say, that we have to help our patient attain, no, and uphold health in terms of effective and efficient interventions. So that's already where you will be in the picture in terms of helping your patient attain health. No, major assumptions for the nursing paradigm. Your nursing person, health, and environment has something to do with the interventions designed to help individual to recognize and fulfill their essential self-care requirement. And we also have holistic approach that acknowledges the interconnectedness of physical, psychological, and social aspect of patient health and well-being, and positions health and dynamic state maintained through proactive engagement and self-care practices. So we have to consider as well proper planning, no? After you assess your patient, you make your diagnosis with your nursing diagnosis, and you are going to plan what you're going to do with your patient. No, that if your patient will not be able to fulfill the activities of daily living or somehow attain health by his or her own, no. Another important thing, if your patient is able to work or to manage, no, you have to make sure that you teach them to become independent. No, you have to make sure that you also have to involve the significant others, guys. No, what do I mean by that? To say, for example, if you're going to care for a patient who is bedridden and doesn't know how to change his or her diaper because of body weakness, and say, for example, no, we have to consider as well uh, the help, no, of the significant others. Now, some techniques that you're going to teach to them as to how to change the diaper of the patient every shift, so that when you go to your patient after at the end by the end of your shift, your significant other is also independent enough to change the diaper, because not all the time that we are at the bedside of our patient. To say, for example, you have almost 10 patients in your shift, and then most of your patients are bedridden, you will not be able to change all the diapers, in a span of 1 to 2 hours, because there might be some certain instance, now your significant other would be asking, or your patient will not be able to cooperate, due to its body weakness, so it's very important that you have to skill transfer it to the significant others, so that by the time that your patient, but the time that the diaper of the patient is already soiled or completely soaked, with urine, or if the patient defecated, the significant other will be the one to change it on their own. So, use of empirical evidence, we have to consider that research demonstrate Orem's model enhance chronic illness management through structured self-care intervention and patient engagement. We have self-care education outcomes that studies show a direct correlation between self-care education initiatives and improved health outcomes of diverse population. And we have evidence suggested that Orem's theory effectively adapts to various cultural contexts, supporting broad nursing practice implementation. So nursing interventions are critical when patients cannot autonomously meet their self-care need, ensuring health maintenance. At the same time, the model emphasizes structured educational effort to empower patients towards effective self-care practice and autonomy. And fundamental goal revolve around facilitating patient autonomy and enhancing self-management capabilities for better outcome. So its logical form that the theory um, deline- delineates a systematic approach for assessing and addressing self-care deficit in patient, and it prioritizes through assessment procedure to identify specific patient needs that require nursing intervention. And we also have to employ, tailored intervention based on identified self-care deficit to promote effective patient self-management. It's very important, guys, that we have to choose the right management if the patient has a deficiency, or self-care deficit on his or herself, so that we can save some time and also conserve our energy. No, there come a time that if your patient couldn't somehow work on their own, we tend to give them some management or interventions which is not really specific to the care plans that you are considering. No, say for example, if the patient, no, a very good example on that is, say, for example, your patient doesn't, say, for example, in the morning, no, that night shift, the night shift nurse already done with the bed pack of your patient. And then here comes a time that you really would like to have a bed bath again for your patient in the morning, considering that no need for you to do it, no, or there's no need for us to do it. It's just you have to consider the hygiene of the patient for you to identify as a problem, no? Then that becomes ineffective already. No, so we have to be logical in what we are doing. We need to make sure that we have to strategize, and we have to make sure that whatever is in our assessment should be prioritized, no, as we identify some problems, no, that your patient is experiencing. So acceptance in education and research, that Orb's model shapes nursing education curricula, fostering essential competencies in patient-centered self-care practice. We also have extensive research on self-care practice emerges from Orem's framework, informing clinical approaches and community health strategies. Another thing is that theory's principles have significantly influenced community health initiative, promoting proactive management among the diverse population. So its application to hospital and school, utilizing Orem's theory facilitates the creation of tailored care plans for patients with chronic condition. So when you say chronic condition, these are conditions that your patient already experienced for the longest period of time. No, a very good example on that is your hypertension. No, so say for example, the patient was diagnosed with hypertension way back when he was 50 years old, and up until now their patient is already 60 years old, still hypertensive and uncontrolled blood pressure. Integration in school program, ORB's framework, is incorporated into the curriculum that emphasizes the importance of patient self-care in education. And we also have to consider patient education, which emphasizes robust educational strategies enhancing patient self-management skills across various healthcare environments. So for further development and ongoing adjustment, ensure the theory remains relevant to changing patient need and contemporary healthcare dynamics. And we also have to consider combining RM's model with complementary theories, fostering a more holistic perspective on patient care strategies, and to continue, no, with research as we explore the theory's effectiveness across varied demographic groups and healthcare contexts. So not just in the hospital setting, but we also have to consider other fields of nursing, you know, such as in the community. We also have in psychiatry, maternal. Okay. We also have critique of the theory, which is something to do with its argue of the model, which focuses on the individual responsibility, neglects broader social determinants affecting healthcare outcome, because it just focuses more into the patient, no? And also the challenge for this, its application difficulty arises in cases of severely impaired patients, limiting necessary individuals' nursing intervention effectiveness, especially those patients who will not be able to participate in what you're doing due to certain disability. You also have the need for flexibility. Its complexity of modern health issues necessitates flexibility in applying Orb's theory to diverse patient circumstances. So to summarize, the model fundamentally promotes patient autonomy, encouraging self-management practices to enhance health outcome and resilience. It provides structured guidance for nursing actions aimed at fostering effective self-care and empowering patients proactively. And despite some critique, Orem series significantly shapes nursing education, reinforcing essential skills related to patient-centered care. And now let's proceed with Imogene King's interacting systems model. So just a few credential and background of King. King was born in 1923, significantly influenced nursing through her innovative theories and educational contributions, developed the interactive system model in the 1960s, emphasizing interaction's role in nursing practice, and the framework centers on achieving patient goal by effective communication and interpersonal relationship between nurses. So the theory sources for theory development. So King's framework incorporates principles of general systems theory, emphasizing holistic patient-nurse interaction and interconnectedness. It's very important that we have to communicate and collaborate with our fellow nurses in order to provide proper care to our patient. A very good example of which is the nursing endorsement. Psychology and Sociology Foundation, influenced by psychology and sociology, which King's theory addresses behavior, interaction dynamics, and social context in nursing. At the same time, King's extensive clinical experience informed her understanding of nurse-patient interactions crucial for effective care delivery. So the major concepts include focuses on individuals' growth, emphasizing the importance of self-awareness and personal development for healthcare. At the same time, highlights communication dynamics between individuals, vital for fostering patient trust and collaborative care environment. And social systems examines the societal role and support structure influencing patient care and impacting collective health outcome. In the hospital setting, communication is very important. We have to communicate with our patient by building rapport in the first place. And we also have to make sure that in a collaborative and communicative way, our management for our patient are well delivered and well implemented to them, both verbal and nonverbal cues, and even how we consider the response of our patient. So say for example, when you're going to give medication to your patient, no, in the hospital, you have to consider na you're going to give certain literature as to what the drug is for and why your patient needs to take the drug. It's very important as well that we foster a collaborative approach to the significant other because there come a time that significant others would somehow relay these information to those who are not in the hospital or not present in the hospital. No, in the hospital setting, we only allow one significant other to be at the bedside of the patient. So if there is a need to communicate those significant other outside the hospital and who will be supporting the patient, who supports the patient, our role as student nurses, your role as a student nurses is to make sure that you provide certain information needed for some updates, no? And at the same time, you also have to discuss as well some reactions. Say, for example, no, you give the medication and your patient was able to experience adverse reactions and side effects. No, you also have to explain that to your patient as to why it was, well, as to why your patient experienced such. No, so as student nurses, we have to equip ourselves with knowledge because there might come a time that your patient would really be asking some questions as to the rationale of what you're doing. So it's very important that we are equipped with it. Okay? So assumptions in the meta paradigm, particularly in nursing, person, health, and environment, that dynamic nursing process is being viewed as a dynamic process requiring adaptability to meet involving patient needs in care. Individuals are considered open system, continuously interacting with their environment, influencing health outcomes significantly. And health encompasses well-being, while the environment presents crucial external factor that affects individual health condition. And in research, it indicates structured nurse-patient interaction significantly enhance goal attainment and overall care effectiveness. So if there is proper collaboration and proper communication, there would be an attainment of goal for your patient. Of course, we have a specific goal that we need to implement to our patient when we have our duty, nor when we do our 8-hour shift in the hospital. When you're going to provide certain interventions, you have a goal to establish. And at the end of it, you're going to evaluate if these goals are met or not met, right? Considering that communication impact is very effective strategy and has been linked to improve patient outcome, fostering understanding and satisfaction. And at the same time, social system influence. Studies show social system critically impact health, emphasizing the need for systematic consideration in nursing care. That's for your evidences, no, and observations. For theoretical assertion, central to King's framework, a strong relationship facilitates mutual understanding and shared goal in care delivery. Is that communication role, effective communication, fosters collaboration, helping nurses and patients navigate health challenges for better outcome. And intentional nursing actions are designed to align with patient-specific health goals, ensuring tailored care intervention. So just imagine if you'll not be able to communicate with your patient, what do you think will happen? No, sometimes your patient would comment that there is an assigned student nurse, but it seems that they are not existing because they are not able to communicate well with the patient. No, in that way, it would lead to dissatisfaction of your care or your interventions given to your patient if you will not be able to communicate with them properly. That is why, as first year nursing students, we have to make sure that our communication skills are already enhanced. Because if you are in front of your patient, by simply greeting them, by simply building a rapport, it's one way or another that we are providing proper communication to our patient already. So, proper communication with our patient needs to be learned because it's a skill. No? So, if you are going to keep on doing on in terms of proper communication, particularly with your classmates, no, you will be able to bring that one once you will be facing with your patients in the future here in the hospital. In terms of logical form, the framework emphasizes that nursing care is fundamentally based on meaningful interactions among participants because it's more into collaborative process. No? It promotes collaborative goal setting, enhances patient engagement through shared decision making and mutual objectives. And King approach blends structured procedures with adaptability, allowing for personalized responses to diverse patient needs. So acceptance in education and research, the King's framework is increasingly incorporating the nursing curricula, enhancing students' understanding of patient care principles. We also have the framework serves as a foundational model of patient-centered care, prioritizing individual needs and preferences. At the same time, in research, to significantly contribute to research and communication strategies, as we are trying to improve nurse-patient interaction and health outcome. So application in the hospital and school setting, the framework guides the development of personalized patient care plan, prioritizing effective nurse-patient interaction. Because when you have your care plan, you're going to communicate with your patient if you're going to implement your care plan. No? And emphasizing integrating King's framework into nursing curricula, fostering skills and beneficial nurse-patient relationship. Actually, it builds trust to your patient. Now, if you have proper communication skills and if you communicate well with your patient, it builds trust. Your patient would really trust you on what you're doing. And nursing are pivotal in creating supportive environment, crucial for facilitating positive health outcome through interaction. So for further development with incorporation of technology, integrating technology enhances communication efficiency, facilitating real-time interaction between nurses and patients during care. We also need to consider research in sophisticated settings, which an ongoing studies explore King's framework with intricate healthcare environment, addressing diverse challenges affecting patient interaction and cultural context that the framework is being adapted to consider diverse cultural contexts, promoting inclusivity and personalized patient care practices. So for the critic, it's been critic that highlights challenges in applying King's framework effectively with acute care setting and varied contexts. When you say acute care setting, it's just a matter of short term, okay? So compared to chronic, that it is being considered in a long-term basis, opposite to it is the acute, okay? And when you talk about measurement challenges, as the difficulty arises in quantifying the effectiveness of interactions, complicating assessments of patient-nurse communication impact. At the same time, calls for care implementation guidelines with a nursing practice to enhance adherence and application of the framework. And to summarize, King's framework underscored the significance of interactive communication, enhancing understanding and cooperation in nursing practice. And we have to advocate a structured approach to establish patient-centered goal, pivotal for effective therapeutic nurse-patient relationship, and despite some critique, the framework of King's remains integral to nursing education, shaping future practitioners' interaction competencies. So, questions so far? If there are any questions, I will be entertaining that during our face to face. Thank you for listening.